Good afternoon. Welcome to the Public Health Alliance of Southern California, a partnership for a healthy place. And with this, our Public Health Alliance and Environmental Health webinar series is called Today, Waste Not OC. And with that, we have two great panel experts for our webinar. But first, I would like to go on and say welcome to all 21 of our attendees. That is great to have everyone on board. And we have a few housekeeping items that I want to bring to attention. Please use your personal mute on your phone to mute yourself. And second, if we are going to have everyone unmuted from the control panel, but if we have trouble with background noise, we will have to mute all. In that case, you will have to press *6 to mute and *6 to unmute yourself if you're going to ask a question. So with that, I would like to go into our wonderful afternoon or the next hour with our speakers. And our first speaker is, I'm going to introduce both speakers at the same time. We have Dr. Eric Handler, MD with a Master's in Public Health, who became the health officer for the County of Orange in August of 2006. His previous experience brings him a lot of national experience, serving as a Deputy Secretary for Children's Medical Services in the Florida Department of Health, and Chief Medical Officer for the Florida Department of Children and Families. He was most recently, he was a Chief Medical Officer for the Boston Regional Office for the Centers of Medicare and Medicaid Services. And with all this different national experience, he was also Associate Professor at the Ohio State University of College of Medicine, where he also received his medical degree from Chicago Medical School and completed his pediatrics trainings here in California at USC Hospital and his master's in public health from UCLA. So he has completed a pediatric rehab fellowship at Rancho Los Amigos Hospital. So we're excited to have a Californian with us today to speak on the presentation on Waste Not OC. And after he completes his presentation, we're going to hear from Mike Holler, who is a program manager for Orange County Environmental Health, Food, and Pool Safety, overseeing a team of field inspectors and supervisors for the past 8 years. His duties also include overseeing food worker education program, the illness prevention section, housing and institutions, and lead program. As a part of outreach for the Food Workers Education Program, Mike has participated with the Cal State University Fullerton in providing instructional to several undergrad health science classes for the purpose of introducing students to environmental health and its principles. Mike also participates in a steering committee member for the Waste Not OC Coalition team committed to ending hunger and insecurity in Orange County. He has served as a subcommittee chair for part of the California Retail Food Safety Coalition and has been on the steering committee of the past S3 Food Safety, Security, and Sustainability conferences. He even has more, where he's been the lead role at San Onofre Nuclear Generating Station program, responsible for emergency response over the years. He brings us a degree in environmental health after 1-year internship in the San Bernardino County Environmental Health, as well as a degree in biology from the Cal State San Bernardino as well, and a master's of public health from Cal State Fullerton. So welcome to Dr. Handler and Mr. Mike Holler for being our two expert presenters today. As I mentioned again, please do a personal mute on your phones or computers. Thank you.
Well, thank you, and thank you for this opportunity. We're really excited to share what we are doing. And what's remarkable about our presentation, I think, is that you're going to be able to walk away from this presentation and do some of the things that we're doing in your own jurisdictions. So this is not the 30,000-foot level that we're having the discussion. This is at the ground level. And so if you could you please click on video number 1? on that slide. There you go.
Yeah.
And you can make the screen larger.
It's a problem that people are ashamed of acknowledging.
Very humiliating.
It's tiring. What are we going to do?
This generation will live sicker and die younger than their parents' generation.
Hunger is right here in the United States.
And the problem is getting worse.
The reason people are going hungry is not because of a shortage of food, it's because of poverty.
1 out of every 2 kids in the United States at some point will be on food assistance.
I was one of those kids that was hungry. It messes.
The average food stamp benefit is $3 a day. There are people who are living on that, and you really can't.
If you have a limited amount of money, you're going to spend it on the cheapest calories you can get, and that's processed food.
My dream is to go to college, but I can't tell my kids, I'll make sure you guys eat in 2 years. I'm struggling to even feed my kids every day.
Put that in there.
Okay, that was a bad idea.
As many as 50 million Americans rely on charitable food programs.
I haven't received a pay raise in 4 years, and what I used to spend on a month in groceries.
It's amazing. Increased insurance. Another way to end hunger.
I don't really know what to do.
Was a that put hunger on the national agenda.
Regular Americans.
I think we can stop the video. It's really choppy.
Okay, I'm going to make it a little smaller. Let's try that.
Entirely by the late 1970s.
It showed that public policy could.
Sorry about that. Let's see. We're going to play it at a smaller size.
All right, we'll try it with the other one. But right now I hear an echo on the line.
Okay, I'm going to go ahead and mute all. Okay, 1 second. All right, and we're just going to continue here, and Dr. Handler and Mr. Haller, if you want to hear anything else you need to, or if you want to speak again, you need to press *6 when you're ready, okay? We're going to finish the video.
Political will could work to make a difference in our country.
There's probably 600, 700 chefs here, all really committed to helping this problem that we have with childhood obesity and hunger.
And working to make sure that families have access to quality, affordable food. It's so good.
There's a lot of education that needs to happen around what is healthy food.
Give your ideas for change, for the healthy life of your kids.
We all have a stake in this.
It's about patriotism, really. If another country was doing this to our kids, we would be at war. And it doesn't have to be that way.
Okay, thank you. Hopefully the next video will be a little bit better. If we could get back to the slides.
Yeah, and I just want to say, Dr. Handler and Mr. Haller, you guys should make sure to turn off your speakers when you're talking, the speakers on your computer. That may be responsible for the echo that you're hearing. So we'll continue from the current slide.
Okay, next slide, please. So, just to give a backdrop on what happened, approximately in November of 2012, I was in Sacramento waiting to go into a meeting and was met by the OC Food Bank CEO, Mark Lowry, and we had a conversation for about an hour, and I asked him 2 questions. One, do you have enough food in the food bank? And he said no. I said, 2, do you think if we captured all the food that was thrown out in Orange County, we could end hunger? And he said, absolutely. And because of that conversation, we developed the Waste Not OC Coalition to address hunger in Orange County. Here are some of the statistics in regards to that. There are 12.7% of the households are food insecure, where they don't know where their next meal is going to come from. Almost 400,000 people each year face food insecurity, and 1 in 5 children face food insecurity in Orange County. Nationally, there are 16 million children who are food insecure. Next, please. Mike Haller was the one that brought this to my attention when we've been in this, while we're doing this campaign, which I didn't even know exists. And it's the Health and Safety Code, Section 101060, that says, the county health officer designate a nonprofit food distribution agency to coordinate and facilitate the donation of food and food products to nonprofit charitable corporations from available sources, including restaurants, grocery stores, or food distributors. I think this is interesting because there needs to be someone to take the lead within the jurisdiction to bring people together to do problem solving to address hunger. And it just so happens that that was the role that Mark Lowry and I played to bring people to the table to have this discussion. Next, please. So what does the Waste Not OC coalition do? Food recovery, where we connect groceries and restaurants to food recovery agencies. We do food distribution, where we connect those in need with pantries that provide wholesome food. And we provide training and education to potential donors as far as food safety and handling. And as you can see from the graphic, that this is a true private-public partnership. And critical to the beginning of this coalition was the role that the environmental health inspectors played. Next, please. So getting environmental health on board was definitely full of challenges. I'm going to turn this slide over to Mike Haller to have him discuss those issues and what they were able to accomplish.
Hi, everyone. We in Orange County and for environmental health, we have a long storied history or tradition of priding ourselves on doing a lot of education and outreach to food safety. And through that, we feel that that's a good balance between education and regulation. So much to my surprise, Dr. Handler had a few of his UCI students that were conducting surveys in one of our cities. And one of the answers to their question was, how come, the restaurants don't donate more food? And overwhelmingly, the feedback was, it was because of us at Environmental Health that we would not allow that to occur. And what was surprising and shocking to me is that we actually have a section in our CAL Code, our California Retail Food Safety Code, that does allow for it. So with all this pride that we had on food education, somehow we were missing the mark with these establishments. There was a disconnect or a huge education gap. And so it didn't take too much convincing afterwards to say, well, we're in the business of educating and regulating, but mostly educating. And so our food worker educator at the time and myself sat down one evening and kind of cranked out this facts to know when donating food and tried to put all the legalese on the back of this one-page document and just created more of a fact sheet that we could disseminate the information to our restaurants that might be interested, and yet they had a misunderstanding that we prevented it. So I kind of see us as an integral part of this from the very beginning, although, at first I didn't quite realize, how interconnected we were. But as we all know from the topic of health, it is all interrelated. And so along the way, we find other things, through this project that we can extend out more of environmental health too, such as we now have a one-page document on expired food. Because after this, one of our questions through our Anaheim pilot project that we did a lot of outreach for started hitting on the facts that people were confused about expired food, all those labels that said best if used by. And so people were throwing out perfectly good food thinking that, again, the health department would cite them if they had expired food. And then we'd also see things like food handling, and when people wanted to donate, how do they donate properly? And so it all came back full circle into the food safety aspects that we target. So it's actually been a great partnership and something that we need to integrate with the Waste Not OC.
Thank you, Mike. Do you want to share when this was presented at the S3 conference, who adopted this?
Well, and this was adopted by other counties, that were interested in this, and I believe now L.A. County, Riverside County, San Bernardino, and San Diego counties all have a variation. As I've heard from my fellow colleagues, that they actually improved upon our one-pager, which is great. And it's just that simple tool to educate food facilities about our donation program.
And for me, if we did not have the support of environmental health, this campaign would not be successful. And it was interesting in conversations with the director of environmental health, who's a good friend of mine. He felt that environmental health is purely regulatory, and they have to stay in that lane. What changed his mind was when we brought our partners in the restaurant community and grocery stores together in November of 2012 and asked them why they were not donating food, and they came up with two answers. Liability was one, and the public health department won't allow us. And that was the turning point for environmental health. And when they came on board, we were able to move exponentially towards food recovery and education. But if that did not happen, we would be moving at a much slower pace. And I don't think we would have been as successful. Next slide. So we've developed a website called wastenotoc.org. And this was developed by 3 students that worked with me during the summer. And let me tell you that the things that we are presenting to you now was done on zero budget. It was all in-kind contribution. We didn't have any funding at all. So on our website, we have a map of 240 pantries. We have information about our different projects, information on how to get involved, and resource download page with Good Samaritan Act. The Good Samaritan Act states that if you prepare the food correctly and donate it, you're not held liable. It just so happens that I've just found out that there has not been a single case brought to the court in regards to a liability issue on food donation. Next slide. So here's a slide of all the food pantries. It's using a Google map. Anybody can do this. And as you look at this, you click on any one of the bubbles, and you can see the name of the pantry, hours of operation, and location. This map has been embraced by the Social Services Agency, especially those who are asking questions to see if they qualify for food stamps. If they don't, they also refer them to the pantry. Our family resource centers are using it, environmental health, our public health nurses, mental health, and other community service programs. They are using this map. Next, please. What's interesting about our website is this is the reach of the website. This is 1 month of statistics. There were 377 individual sessions on that site. 62% of the visitors were from low-income cities, and 38.5% were returning visitors. And look at the global reach. We've gotten hits from Brazil, Canada, Germany, Italy, India, Ireland, Slovakia, Philippines, and Vietnam. Next, please. So hopefully this video will work. And what I'd like to do is if you could click on the video, and it's why don't we ask the question. So let's show that video, please.
And can you put yourself on mute while we play this to reduce the chance of feedback?
It is.
All right.
Am I going to get in trouble? No, you're not going to get in trouble. They're not even going to know, okay? I can't go to school if I'm sick. Just go to school so you can get some lunch. Then you can come home afterwards.
Can you do me a favor, please, and show that one more time?
Sure. We'll try it bigger.
Am I going to get in trouble? No, you're not going to get in trouble. They're not even going to know, okay? I can't go to school if I'm sick. Just go to school so you can get some lunch. Then you can come home afterwards.
Thank you. If we can get back to the slide. So I'm a pediatrician, and in my 30-plus years in my career, I have never asked any family that I took care of if they suffered from food insecurity. If we can get to the slide. Can you hear me okay?
Yeah, we hear you great.
Okay, I just don't see the slide. There we go. Not yet. Okay, and if we can, there we go. So why don't we ask the question? Why didn't I ask the question? And when I make these presentations to healthcare providers and ask how many of you asked that question, no more than one hand would raise, and it's probably they would raise their hand and they're a social worker asking the question. So for me, it made absolute sense that we needed to start asking that question. And if families answered yes, part of the problem was historically is we didn't have an answer for them if they said they had a problem. That's where the Google map of all the food pantries come in handy. And what's very interesting to me is we are working right now with Ultimate that has 7 community clinics in Orange County. We know that there are 2 questions you can ask that will tell you whether a family is facing food insecurity. At intake, they are going to talk to their clients and ask that question, and if the answer is yes, they will pull up the Google map and tell them which pantry they need to go to get food. They are incorporating this into their electronic health record, which to me is absolutely remarkable. I made a presentation to the St. Joseph Heritage Medical Group, which is a large group in Orange County. They're interested in doing that as well. Now imagine being able to do that. But what we're trying to accomplish is a twofold impact. The food pantries and the food banks need food. So we're directing a lot more people there. But we're also increasing the food supply by having food donated by restaurants or grocery stores that haven't been doing that previously. So we're increasing the food supply and we're giving people the opportunity to get food at the pantry. We have a free clinic called the Lessenach Clinic that's adopting a local pantry. And anybody can make a difference. And one of the ideas is for a community to adopt a pantry, to knock on the door, to see what they need and how we can help to get more food and to start making this a community effort. And I was just on a panel today called Coast to Coast Hunger Summit, and they were talking about the neighborhoods getting involved. As the public health officer, when there's an excessive heat emergency, we put out a press release telling people what measures they can take to get cooler. Cooling centers, keep plenty of liquids and stuff. But the single most important thing that I recommend during a heat emergency is to check on your friends and neighbors. What would happen if part of our hunger campaign is that you check on your friends and your neighbors to make sure that they're not hungry, and if they are, to reach out a hand and help them. It can start at that simple a level, and you can expand from there to adopt a pantry, to whatever. So people should not be paralyzed to not move forward to address hunger. I can remember walking into my boss's office and saying, I have a new project, I want to end hunger. And it was almost like I was a beauty pageant saying, I want world peace. He goes, that's nice. But a lot of people, when I talk to my colleagues, say they don't know where to start. They don't know how to move this needle to start addressing this issue. And we have developed a simple toolkit that will allow people to do that. The toolkit consists of the Google map, the one-pager that was developed by our environmental health specialists, the questions that you can ask. So there's a whole host of things that are available. Next slide, please. Here are the 2 questions that have been proven to be valid. Question 1. Within the past 12 months, we worried whether our food would run out before we got money to buy more. And question 2. Within the past 12 months, the food we bought just didn't last and we didn't have money to get more. To me, there isn't a more important public health issue than hunger because it impacts your health, your education, your well-being. And for us not to have a campaign to address this, I think, is a huge mistake. And that can be easily corrected if you have the right people around the table who want to make a difference. Next, please. So I'm going to turn this over to Mike with the backdrop that people are saying, tell us whether you've been able to demonstrate success. And what we wanted to do is focus our resources in a particular area and see if we could generate increased donations. I can tell you we have 2 food banks in Orange County, one called Second Harvest and the other one Orange County Food Bank. Second Harvest, from years 2012 to 2013, they looked at food donations, and then from 2013 to 2014 fiscal year, they looked at donations, and they increased by 50%, which is pretty remarkable. So I'm going to let Mike talk about the Anaheim pilot and sort of how it evolved and where we are right now with that.
Okay, so the Anaheim Food Recovery Pilot was our citywide effort, and like Dr. Handler just stated, that we had to concentrate our resources to check and see if it would work in one area, and we chose Anaheim because it had quite a wide range of demographics. Obviously, it houses the venues of Disneyland and the Anaheim Stadium and the Honda Center and the Convention Center, and then it also has smaller, more ma and pa type of food facilities, and it caters to a wide variety of diversity. And so with the citywide effort to increase food recovered by identifying and educating the potential donors, our department was involved, or the environmental health specialists were involved with, as they went through and conducted their routine inspections, they would hand out informational flyers regarding Waste Not OC, and that this project was actually off the ground and where they could contact to donate food. And we learned a lot of things in those surveys that we really didn't even think about either. Like, I'll just give for one example, we went to a chain, a pretty nationally recognized chain, and they were donating food. So the questionnaire said, well, we're donating food, yes. But then we found out that they weren't donating to their capacity because they didn't know what to do. Their corporate offices were telling them that they had to discard the food within 3 days. That's just a corporate policy. And so they had one donation center that they would go to, and they would collect quite a bit of food with a high volume, and they would donate it on, I think it was like a Monday. Well, they were still then collecting the food, but they knew they couldn't collect it Tuesday, Wednesday, Thursday, or Friday because that would be in excess of their 3 days. So then they were disposing, they were actually throwing away that food. And we were able to give them and connect them in with another site that they could donate to. But they just didn't have that information available to them. And again, I think it was a little bit of fear also because almost sheepishly they told us, well, we do donate. Are we going to get in trouble for that? And they said your inspector had just been by and said we wouldn't. And so again, we kept going back to this education and outreach, and they actually saw us as a partner in helping with their cause, and very committed. So it was just one way of doing it. Now, there are other folks that will get motivated in different ways, and one of the ways we thought that they could get would be motivated was from the recognition. That seems to work well for us. We have an Award of Excellence program for those food facilities in Orange County that do excellent food safety. So why not have some sort of annual window seal to honor those participants working to end hunger? And that way it would be a motivation as well. So during this food recovery pilot, we discovered quite a bit of differences, people that wanted to become involved. We even had one that we were kind of surprised at where they didn't have any excess food, really, because they cooked to order, but they were so interested in the project and helping out that they said, well, we'll be willing to cook more food. And it just kind of blows us away a little bit when we hear about, the goodness and the kindness of people that are not only concerned about food safety, but they're also concerned that other intertwined health issue of hunger. So again, the Anaheim pilot project was good because we started out small. And if you are thinking about doing this and starting out a program like this, I can say is that you start small and take those steps and then keep growing it.
So this pilot has morphed into what we are now calling the Food Recovery Task Force. And we're looking at Anaheim and Orange. And the CEO of Catella Grill is taking the lead in bringing people in the industry to help get the word out, to convert restaurants or grocery stores to be donators. And so we're doing this at that business level, not having public health do it or volunteers. They will be involved, but having a core business group that will take this on and volunteer to move this forward. So we're very fortunate. This project has taken a life of its own, and on several fronts. About 3 months ago, I got a phone call from our United Way people, and they said, our board met yesterday, and they want to give you $50,000. And I said, we didn't even put anything in. We didn't propose anything or didn't apply for a grant. And they go, we know the work your coalition is doing. We want to support it. We're going to write you a check. And this is the feel that our coalition has. It really, truly is a grassroots coalition. Next slide. So as I'm reading this, I'm going to have Mike read this because I get tired of doing this. But as Mike is reading this, I want you to think who said this. And then I'll tell you at the end. Take it away, Mike.
Okay. This culture of waste has made us insensitive even to the waste and disposal of food, which is even more despicable when all over the world, unfortunately, many individuals and families are suffering from hunger and malnutrition. Once our grandparents were very careful not to throw away any leftover food. Consumerism has led us to become used to an excess and daily waste of food, to which, at times, we are no longer able to give a just value which goes well beyond mere economic parameters. We should all remember, however, that the food we throw away is as if it were stolen from the table of the poor, the hungry. I encourage everyone to reflect on the problem of thrown away and wasted food, to identify ways and means that, by seriously addressing this issue, are a vehicle of solidarity and sharing with the needy.
So somebody sent me this. Thanks, Mike. That was a very good reading. Somebody sent me this, and it turns out the person who said this is the current Pope, Pope Francis. Next slide.
Okay, so are we going to transition to the second video or the third video?
Well, before we do that, let me give a little backdrop. And hope if it doesn't play well, then we can stop and just take questions. If it plays well, fine.
Okay, I'll let you give me a heads up, and we'll just play it at a small size.
Okay, right. So in February, I got a call from PBS in Washington, D.C., and they said, can we talk to you? And I said, sure. And we had about a half-hour conversation and about what we're doing with the campaign and things. And didn't hear from them for a couple of weeks. And then got a phone call saying that we're going to send a film crew for 3 days to film. what you're doing in Orange County. Now remember, we don't have any editing capability here. What they do is what they do. We can't say, well, can you change this or change that? So that put us in jeopardy. Number two, you do know that in Orange County you got the very rich and the very poor, and I'm sure that was part of the motivation for PBS wanting to do this story. So we were not certain how they were going to promote this and what they were going to actually show. Surprisingly, it's a 7-minute piece, about 7 minutes, and they did a remarkable job highlighting the issues. So hopefully you'll be able to see this. If you can't, if you go to wastenotoc.org and click on the News tab, there is the PBS special that you can watch from there. So let's see if we can show it.
Okay, we're going to transition over to that. Hopefully it will work.
It's known as one of the most exclusive places on Earth, the home of the rich, and spectacularly rich. Orange County, California's reputation only grew when the TV crews started rolling in several years ago. But the Real Housewives of Orange County and the Teens of Laguna Beach failed to mention a major piece of the OC drama. The county is also among the top 10 in the U.S. for childhood food insecurity. The term means that along with the yacht clubs and average home prices of nearly $2 million in some spots, Orange County also has more than 150,000 children who don't know where their next meal is coming from.
We're going to try to have
Paul Leone is the president of the Illumination Foundation, a group that helps struggling families find housing and stability.
Orange County is basically the tale of two cities. We have the area that we're standing in right now, which is Newport Beach, is the richest city in the nation. And then 17 miles away, we have one of the most densely populated and poorest cities in the nation.
Among the poor are thousands of low-income workers who support the county's luxury economy. Before Leone's foundation intervened, kids in the Tina Pacific neighborhood of Anaheim often skip meals. Michelle Cummings, who volunteers for the foundation and lives in Tina Pacific, was one of the first to recognize how hungry her neighbors were.
One night we had pizza delivered, and a kid came over like a half an hour later, and he was like, "Do you have any leftovers? I'm really hungry." And I was like, Are you serious? And he's like, "Yeah, I'm hungry." And I'm like, "Oh, come on, here, take it, the rest of it."
Cummings made some calls and helped organize a program called Kids Cafe. Now, each day after school, she passes out fresh...
I think we should probably stop the video, and if people are interested in watching it, they can definitely go to the waste.oc.org.
It may be that it's playing more slowly on your screen than other people's screens.
Okay, so let's continue then. All right.
Let's continue, and people can get a sense at least of the audio, and then
okay.
That's
they
fine.
Can all right.
Later.
Not long ago, she and her 9-year-old daughter, Sophia, didn't always have enough nutritious food either.
No problem.
When Cummings lost her job, her life spiraled out of control. Stable housing can be hard to come by in a place where average rents top $1,200 for a one-bedroom. They found themselves in line at the Armory's homeless shelter, then living in a low-rent motel where it was difficult to prepare little more than cheap processed food.
Like at first we were just doing microwave meals every night, and it was horrible. The salt in them is horrible. So before I got like cooking stuff, we were living off microwave meals definitely.
For Cummings' health, it was a recipe for disaster. Within months, she gained close to 40 pounds. That worried her, but even more so, she worried about Sophia, and for good reason. Recent studies by the National Institutes of Health suggest that a lack of nutritious food, especially during childhood, can have long-lasting physical consequences that linger for years, if not decades. Among them, anemia, early-onset diabetes, high blood pressure, cardiovascular disease, depression, stunted intellectual growth, and obesity. It's that last point that many find hard to reconcile, the presence of malnutrition and obesity at the same time. But most processed foods, while high in calories, simply don't contain the nutrients that are so crucial to good health and productivity. There's also evidence that the body stores fat differently in times of stress, and that alternating between eating more when cash and food are plentiful and less when they're not triggers the body's feast or famine reflexes. The result? Weight gain. Barbara Laraya of the University of California at Berkeley has been studying the long-term impacts of hunger for 2 decades and says it all means the nutritional odds are stacked against low-income families.
So we have these stressful situations where, the body's saying, I need some energy, reach for the cookie. And at this point in time in the United States, cookies and snack foods are everywhere. So not only is the income restriction leading to purchasing energy-dense foods, but it's the stress as well that absolutely leads to the perfect storm of gaining weight, possibly developing chronic disease, and it might be associated with later chronic disease for children.
That's why with 1 in 5 children sometimes going without meals in the communities surrounding Disneyland, Orange County has begun approaching the issue like a public health crisis.
Has it been tried?
It started when OC Public Health Officer Dr. Eric Handler ran into the director of the Orange County Food Bank recently and had 2 basic questions.
One, is there enough food in your food bank? And he said no. And I said, if we were able to capture food that's wasted and direct it to people in need, could we end hunger in Orange County? And he said yes, and that was the start of this campaign.
About 40% of food in the U.S. is wasted, too often ending up in local landfills and buried. With that in mind, Handler started pushing the idea that businesses can easily change their habits and have an impact. So, for the past few months, Handler and his team have been hitting the road in Anaheim.
We are very hopeful that there will be significant increases in number of establishments donating food.
Hoping to target first the largest food producers, places like Disneyland, Angel Stadium, the Anaheim Convention Center, and the Honda Center.
Our goal is to find out which establishments are currently donating food and which are not, and those who are not donating food to educate them to the fact that they're not held liable if the food is correctly prepared.
One of the companies working with the Waste Not OC Coalition has already shown the concept can work. The Cheesecake Factory near Disneyland donates 200 to 300 pounds of food each week that's been fully prepared but left unserved. In the last 5.5 years, the chain has stored, packaged, and handed off more than 2.5 million pounds nationwide. Members of local food banks pick up the food, which is often healthier than the packaged variety donated in food drives.
Hi, how are you today, Dr.
On the consumer end, the Waste Not Coalition is also working to convince Orange County healthcare providers to ask questions about hunger during routine primary care visits.
Is there any time in the last couple of months that you've had difficulty financially purchasing adequate food, fresh fruits and vegetables for him or your family?
The idea is that people like Dr. Phyllis Agrin stand the best shot at breaking through the stigma and getting people the help they need. Agrin agrees and has been willing to give it a try. But she also says local projects of this kind are just a piece of the solution.
More importantly, I think as pediatricians, we have a responsibility to children to advocate at the local, the state, and the federal level for policies that will eliminate food insecurity in this country.
Back in the neighborhood of Tina Pacific, things are looking up for Michelle Cummings. She recently landed a job as a caretaker for the elderly, which means that she and her daughter have enough food and a better mix of it. Now that she has a kitchen, Cummings can buy in bulk, cook from scratch, and make her food stamp dollars last.
I wouldn't say I can buy whatever I want, I don't barbecue steak every night, that's for sure, but I make it stretch.
On the menu this night, reheated soup laced with fresh vegetables. Not the most elaborate meal in Orange County, but at least it's healthy, she says, and enough.
All right. So thanks, everyone, for hanging with us through that one. Do you have any other closing comments, Dr. Handler?
Just to let you know that we are not a 501c3. We partnered with an organization called Food Finders, which is a not-for-profit that goes out, picks up food, and delivers it. So they are a very important arm to this whole coalition. And so when people donate resources or money, it goes directly to food finders. And without the support of the healthcare agency and environmental health, I really don't, and I'll reiterate this again, I don't think we would be able to get traction to where we are right now. I can tell you, what's most remarkable for me, I returned from Manhattan, New York, where there was a social innovation summit that was held there with Fortune 500 companies. We have a representative from the White House who's interested in pushing out this toolkit nationally. We have the American Academy of Pediatrics Task Force that's looking at poverty and hunger in children that want to have our toolkit as part of their recommendations that people can use. So people are coming to us and saying, what can we do to help and how can we do it in our own community? And to be quite honest, this has gone beyond my wildest expectations. And the success of this has been because the coalition partners are dedicated and passionate about ending hunger in Orange County.
That's great. Well, thank you so much, Dr. Handler and Mike Haller, for your presentation. And my apologies for the various junctures at which the videos may have not worked. Did our best. And I'd like to open up the floor to questions. I think I will do that by unmuting people. I'm going to unmute all. So hopefully that will allow us to have sort of an open conversation on this topic. So I'm going to go ahead and do that. One second. Okay, so everyone should be able to unmute themselves using their personal mute and ask questions of our presenters. And maybe I'll just get started with a quick question for Mike Haller. I was wondering what kind of, in addition to the liability concerns and the concerns around it not being required by or not being allowed by Department of Environmental Health to do food recovery, did you face other barriers in working with restaurants on this process?
I would say that the only other barriers that we had was a little bit of hesitancy on our part. As you might understand, we're regulators. We do have that part of us, and we didn't want businesses to feel like they were obligated to participate. So we're very careful about how we address these folks that, and a lot of them had questions if they were donating. They wanted to know if they needed to donate to the Waste Not OC Coalition, and we said no, we just wanted to see and have a survey of if you were donating, if you had food waste. Some say, quite honestly, they don't have any kind of food waste. And then some, it was just the education, the outreach. And, of course, any of that takes time. So that's a challenge as well. And how do you incorporate that into your regular duties as an environmental health specialist? So, and then, trying to figure out the other components and the other angles that we had. For instance, we're in environmental health, so we're very concerned about what goes into the landfill as part of our auspices. So, that's a component as well, too. So if we could rescue the food and have it diverted away from that normal waste stream, that's a big positive as well. So we had a lot of moving parts. I think that was our biggest challenge, is where to get started with this.
One thing I think is interesting is that you seem to have had success working with some nationwide franchises and chains, and I think that can be sometimes challenging because their corporate control is sometimes somewhat remote from their various locations. Do you have any particular advice in terms of working with those types of organizations?
Well, we've been pretty lucky because, this, as Dr. Handler mentioned, this is a a broad coalition. It touches a lot of people that I've never met or worked with, like food finders. And we do some work with the Orange County Food Bank. They'd reach out to us for food safety advice for their own volunteers. But I've never really worked with food finders and everybody. But we did have connections with these nationwide chains through our professional organizations. So we had established that network already, which did help with the legitimacy of Waste Not OC, that people very much trusted us because of years of relationship building. But that's something that I think all environmental health departments do, and they are very successful at, is having that network of good professionals. So I think we were very successful there on getting it. And of course, they have some of their branding or image to protect as well. And so that has a lot to do with the trust of trusting the health department, having their legal department come out and take a look at CalCode and say, run it through its paces. Tell us if there's any liability concerns, and the intent of it was to not have any liability concerns. So if there's something there, reach out to us. We'll change the law. We'll get something changed on it. So I think all that has helped overcome some of our big challenges.
In addition, we have had some pushback from major chains. We'll be perfectly honest there. But they have come on board slowly, and we've been working with them. But I'll tell you one tool that we use that helped motivate them. On our website, under the Anaheim pilot, we have a Google map of those establishments that are donating food. And you can bet that people they want to be on that Google map recognized for donating. So when we do have resistance, not only at big corporations, but small organizations as well, there's motivation for them to have that seal that has been developed and to get on that map. So there's a bit of peer pressure that's being applied as well.
That's great. And then I see that there's a question from Gail in the chat box. Gail, did you want to ask that yourself, or? I think I'll just go ahead and read it.
Go ahead, please.
It says, in your toolkit, do you encourage WIC referrals for children 0 to 5 and prenatal women?
Well, in our toolkit, the answer is no. However, in the healthcare agency, we have the WIC program and maternal and child health program. So they're very well aware of our initiatives. And it's just another tool for our family resource centers and our public health people to utilize when they are taking care of clients who are in the WIC program. So it's to augment what's happening.
Great. Do we have any other questions from any other attendees?
This is Donna Fenton with Kern County Environmental Health. I have a question. We were working with the local schools to try and develop something, and we did come across the liability issue, but also their situation may be a little bit different. While they have a lot of food waste because of the requirement for them to provide a certain amount of servings of fruits and vegetables that sometimes the students don't want to eat. So they want to still encourage them to take that, and a lot of times they've served them maybe a carton of milk or an apple or an orange that hasn't been cut and is fully intact, but they consider that reserviced because it's already been provided to them on their plate and they've taken it back. Have you addressed anything that would deal with some sort of program that would ensure that you still have, the food safety there, but allow them to be able to donate that type of leftover food?
Yeah, Donna, it's Mike Haller, and yes, we have encountered that, and we've encountered other issues with the schools as well, in that while they do count up how much food that they take in, it doesn't bode well for that school that's trying to meet those nutritional requirements as you suggested. And so schools are very hesitant, even when they have intact food items that could easily be donated, to actually go ahead and make that known, because it's almost like they're creating their own firestorm, like, why aren't the kids eating nutritious foods? Now, with any kind of the reused foods or the milk or the those type of issues. Anything that's been subjected to any kind of temperature abuse or that's been served and they can't, if it's not prepackaged, it's got to be disposed of. So while we're not 0% or the zero waste and trying to collect everything, we still have that food safety issue in mind, and we're just trying to minimize as much waste as they've been collecting. So a lot of education goes out to those folks who want to participate. We didn't mention the jail program that came to us, and one of the officers had been saying that they had been seeing a great deal of waste because of the nature of transitioning prisoners back and forth. They have certain requirements to make so many packaged meals, and it was just killing the deputies to see these prepackaged meals that had been kept in hadn't been distributed, and it was just being dumped. So we had a long discussion about the liabilities, about the food program, about what could be saved and what couldn't be saved.
So on the panel that I was on this morning, the Coast to Coast Hunger Summit, it was interesting because there was a representative from one of the school districts, and the comment that they made during the presentation was the fact that they had this food, not a large amount, but they had no one to pick it up and to deliver it. And I said, well, we have food finders. You could call them and do that. So finding out where the gaps are and addressing those gaps will get, I think, them to consider more donations. And the pickup and delivery was a huge issue for the school district.
So Donna, we are an integral part of that food safety puzzle and helping them, because a lot is not just about educating them on that they can donate, but what to donate. And so that's the other shoe that falls, is that gets us involved. And I'm pretty proud. We have a group that, as part of their volunteer projects, that the inspectors they go. It's a performance incentive program that we have in Orange County, that a lot of them donate their time, or they get signed aboard with doing outreach to the food banks to help educate the people that are going to pick up the food, what to watch for anything from vermin identification, because of course you don't want some of the foods that are contaminated or and have food temperature abuse, and proper hand washing, just to ensure that whoever they're picking it up from has taken real good care of that food, and that the food is eligible for donation. I hope that helps.
Yeah, it does. Thank you.
Okay.
Close to time, but if you have further questions for our presenters, you can email me. We'll be happy to post any interesting answers on the website. And I just also wanted, before I closed out today, to say a big thank you to Mina Brown here at Public Health Alliance of Southern California. She is moving on from our organization to go travel the world and experience all that it has to offer. And I just wanted to thank her for setting up these wonderful Department of Environmental Health, chronic disease sort of coalition calls over the past 6 months. So a big sort of virtual round of applause for Mina. I really appreciate everything that you've done. And we'll be continuing our series in July, subject to be determined, but it may be on mobile vending. So thank you again to our presenters today, and to Gail and to Mina and everyone who makes these calls possible. And we'll look forward to talking with you all next month.